In every community, there are stories, quiet stories of courage, care, and compassion. This is the story of Hospice Care in Elkhart County. A history rooted in love, nurtured by dedication, and now flourishing with hope for the future. It began simply. In 1982, a group of volunteers saw a need to care for the dying with dignity at home, surrounded by love.
Until you have the chance to experience what hospice is all about, you don't have any idea, but it's just, they're so caring, they're so humble, they're just, the way they take care of a person in their final stages, it's amazing. It's a wonderful thing.
So Jan Yoder was the person that created Elkhart Community Hospice back in the early 80s. Very passionate about care for the people that needed hospice, and so she developed a staff over the years. It takes a real skill and a nurturing care to be able to do that properly.
Elkhart Community Hospice was built from the heart, one patient, one caregiver at a time. By the late 1990s, the need for hospice care had grown. To meet it, Elkhart Community Hospice became part of Elkhart General Hospital.
One of the things about being involved at Elkhart General at that time was Elkhart General had a terrific culture and focus on the patient and taking care of the patient. And I think that was an asset they had that a lot of people didn't really realize how maybe unique, but how special that was.
Elkhart General Hospital didn't have a hospice organization at that time, and so they were interested in getting into hospice care. They didn't want to kind of create a new organization. We already had Elkhart Community Hospice, so there were discussions going back and forth about whether or not we needed to merge the two organizations. And we were actually renting space from Elkhart General Hospital where our staff and administration was working. One of the things that led us to merge with Elkhart General at the time was that we felt that they would be able to provide more resources to be able to grow the services. We had a vision of having a hospice house in Elkhart. The Elkhart Community Hospice House was kind of a new concept as well.
When I look back over the last 20, 25 years, I remember when Elkhart General Hospital gave their fledgling hospice program to the fledgling Center for Hospice Care. It was a step in building the behemoth that it is today, the largest and most important in our community, and probably one of the most well-respected in the nation. What it's done, it's taught people that dying is not a horrible thing. Dying can be a beautiful thing. We just need help. And Center for Hospice Care has provided us with that help.
In 2005, a new partnership emerged. Elkhart General entrusted its hospice program to Center for Hospice Care, a respected, mission-driven organization serving the region since 1980.
At the time I was on the hospital board, hospice was, Center for Hospice was a separate organization, and at some point during this tenure, it became evident that there were an excess number of hospice providers in name, but not necessarily with the necessary talent to provide the services that a patient or family should expect from hospice. And the opportunity came for both the Hospice Elkhart General and what is now Center for Hospice Care to merge.
20 years ago, the Center for Hospice Care was entrusted with something very special, and that was the transition of the hospice program from Elkhart General Hospital to Center for Hospice Care. And it wasn't just a transition of services, but it was a continuation of a legacy really rooted in compassion. Like other communities, hospice care in Elkhart Community started as a grassroots movement, but it was more. It was neighbors caring for neighbors, people who believed that no one should die in pain, and no one should die alone. And that was a promise, and a promise that we've kept. When the Center for Hospice Care assumed the program in 2005, we knew we were stepping into something sacred. We were called to honor the work of those who came before us.
And so began a new era, one rooted in continuity and enriched by possibility. In 2008, a dream took shape. Esther's House, Elkhart's first hospice inpatient unit, opened its doors. But this wasn't just a building, it was a promise fulfilled.
Elkhart is a very generous community. When they see a need, the people in Elkhart step up. And so the joy was that with the initial early support, funds were able to be raised to build a facility that I think was really at the time as fine a hospice care facility as there was any place.
I think the Center for Hospice is such an important group, and what they do for people. Dick's mother used to love to have them come. She looked forward to them coming and being there and spending time with her and that.
Probably a year after she was passed away, we kept talking about Elkhart needing that kind of a facility. And so we decided that we got a couple of our friends with us that are also in business around the Elkhart area, and decided to see if we wanted to get a hold of them and see whether or not they want to kind of come with us and kind of help us create this process of getting something into Elkhart. And we finally did.
Esther's House really started as an opportunity for people that needed specialized inpatient care to be able to have that care, but in their own community. And I think that's one of the things that I love about Esther's House is that it was really created by members of that community for that community.
It was around that time that Dick and Rita Streffling approached us and said, you know, we really would like to see there be a hospice house in Elkhart, similar to what you have in South Bend. And it prompted him to begin thinking about and envisioning what could be a meaningful opportunity in the Elkhart community. And so that was then, he had this brainstorm and suggested that they would be happy to support that initiative.
I think one of the things we really wanted was a place where you could go to get away a little bit from the situation that you were in and to be able to be outside or to be able to be on a porch. We wanted it to be homey. We wanted a person to feel like they were at home, that you could be in a place that was peaceful, that you could reflect, that you could pray, that you could just be by yourself, but that you didn't have to be right involved in the situation at that time.
Al Ludwig and his wife Karen, immediately good friends of Dick and Rita, said, I've got some land. How about some land? So they donated the land to get it started with.
So we wound up with 11 acres, and it's beautiful, and the entire facility was designed within that space, for that space, and with the idea that down the road, were we to need to add on to the building, there's the ability for us to be able to do that. And so we were very fortunate to have that gift of land. It created a space for us that doesn't exist in other communities within our area, where we actually had an inpatient facility. There are a lot of hospices operating in our 9-county service area. We serve 9 counties these days. And there are a lot of hospices operating. We're the only ones who have Medicare certified inpatient units.
I think that was a source of pride that Elkhart got it done. And that's one of the things about the Elkhart community is they are pretty much a get it done type of mindset. So if they see something needs to be done, they're willing to pitch in and get it done.
But CHC's mission didn't stop at bedside care. From bereavement support to educational outreach, the impact spread wide.
One of the things that we've been focused on is really expanding our services beyond hospice care. We've been able to provide palliative care services for individuals in the community, and our palliative care services really extend well beyond what would normally be provided by a hospice. But we're really, with our team of people, physicians, nurses, community health workers, and others that can go to patients' homes, see them there, manage their care, help manage their symptoms, and really keep people where they want to be, and that's at home.
We're the only nonprofit hospice in this area. People like it. We're the only ones that offer a hospice house that sets us apart from other hospices. So it's just people see it, they understand it. Once you've been affected by it, you can't help but tell other people how it helped you get through that process of your dying loved one.
There are so many opportunities for us to grow our services. I know we care for patients, but we also care for those families for 13 months after the death of a patient or longer if they need it. So we're hoping that we can expand some of those services. The other thing that we're looking to do is expand the care that we provide to our pediatric population. So having that opportunity in Elkhart County would also be helpful.
Well, the Crossroad campaign truly was an endeavor to build the whole Mishawaka campus. But it wasn't just for Mishawaka. So it was really an assist to Esther's house in Elkhart and an assist to all the staff that handles the Elkhart County residents. We're currently fully staffed. Our census numbers are near an all-time high at Esther's house. We just need to bring our facility up to today's standards and truly into tomorrow's standards. And I know our community partners with great fiscally responsible not-for-profit organizations to make that happen. So for us to be the absolute best, we need to partner with our community.
I think hospice is a part of our passion because of Scott's dad. We all were so close with him, and it's the first our family has had to deal with a death of somebody that close. We could not have done what we were able to do without them. And I think we will be forever grateful and forever ongoing contributing to hospice. It's a big one for us.
Today, Center for Hospice Care is preparing for the next chapter, renewing and expanding the Elkhart campus to better serve the community for generations to come.
Our hopes for the Center for Hospice in Elkhart County in 5 or 10 years would be that they can help and house however many people may need them at any given time.
When I think about the future of the hospice house in Elkhart, it's just the hopes that it can stay, it can maintain, it can be there for years and years to come to keep serving people like myself, how I was served with our family members. It's a wonderful addition to Elkhart County. It's great to have. It's one of a kind.
It's profound and very insightful that the initial investors in this facility walked with it, guided it, and some of them have actually even used it. So that's why we need to band together as a community to make this facility last forever.
Your generosity, your time, your gifts, your belief in our mission have made this journey possible. Places like Esther's house are more than just buildings. They are sanctuaries of peace built by a community that cares. And today we look into the future. Our campaign to renovate and enhance the Elkhart campus, including Esther's house, is about more than construction. It's about creating a space that reflects the love and the dignity that we offer every day. As you know, hospice care is not just about endings. It's about meaningful movements. It's about love, legacy, and lives well lived. As we celebrate 20 years of transformation, we invite you to shape the next 20. Together, we continue to walk alongside families, offering comfort, dignity, and peace when and where it matters most.
For 20 years, Center for Hospice Care has been a constant presence in Elkhart County, rooted in community, compassion, and care. With your help, the next 20 years can be even more impactful. Together, we honor the past. Together, we embrace the present. Together, we plant our future.